you for allowing me to share with you my insight on the topic, which is close to my heart, and which is very important since more than 4 billion people around the world don't have a correct health coverage, and also more than 70% lack access to safe surgical care, and 9 out of 10 in developing world. So things are not available because lack of money, poor organization, or sometimes administrative hustle, and that is my case. So how to solve this, optimize what we have in hand. I'm not talking about just objects or devices. It can be optimization, organization, and so on. So Bernard Shaw has said, those that cannot change their mind cannot change anything. So we have to start by changing our mind. So during our talks or our teachings, we are saying this technique or that technique is difficult. I will take example PCNL. So people are afraid to try it. So what is easy and what is difficult? That is the question. So for me, difficult is flying like Superman. And what is easy is many people are doing it. And my philosophy is if there is a human being is doing something in the past or in the future, any other human being has the potential to do it. But we mistake easy to do with but needs a lot of time with difficult. Is it difficult to climb 1,000 stairs compared to 10? No, it is not difficult. It is the same technique. We climb one step at a time. So is PCNL difficult? It is not difficult. It is easier than crossing the street. When would you let your child cross the street? Not in Europe, in developing countries. When he's 10-year-old or 20-year-old, so you have to coach him to take his hand, and you have to be really careful, otherwise there is a lot of complications. So instead of saying beware, PCNL is difficult, we can say PCNL is easy. You just need longer time to learn, and you have to be rigorous, and you need someone to hold your hand. So I started PCNL in '97, and in Morocco, everybody was saying, don't do PCNL if you don't have an interventional radiologist. I didn't have one, and it wasn't available in Morocco. Should I have continued to do open surgery and not following the guidelines? And even now, I don't have a radiologist in my city. Should I stop PCNL? So I think that we should adapt the rule and dogma to our local conditions. But it is important to follow the guideline. I have done many cases of PCNL. I am coaching more than 10 centers in Morocco, many workshops in Africa with no interventional radiologist. The important is you have to strive to be a good surgeon. And Dr. Dasgupta had said in his talk in EAU18, strive to become a surgeon, a good surgeon, particularly if you are in the developing world, and stop obsessing about technology. And you have to be a good surgeon waiting for DIY surgical robot. So we are reusing cystoscope and ureteroscope. Why not reuse single-use scopes? Also, there is the problem of low insurance reimbursement. So in Morocco, PCNL, the whole procedure is less than 1,000 euros, and retrograde intrarenal surgery less than 800 euros. And the single scope costs about 700 to 900. So it is impossible to do the procedure without reusing guide wires. So when I started PCNL in '97, I have done more than 30, perhaps more than 50, with one en place sheet, and it was already brought from France. So, and also I am coaching a few groups of urologists in public hospitals in Morocco, and until now, the hospital is not providing disposables. So I think that we should would be good to have an organization of collection, refurbish, and sterilization to have more safety for the patient. Also, we have to promote meeting and session like this one to promote innovative thinking. I will talk to you about a session held in SIU since 2012. It is an idea of Daniel Yashia, Symposium on Affordable New Technologies in Urology, and there is a competition for the best affordable device. Here are the winners from previous years, and you will find the rules in the SIU website. And we had a lot of ideas, more than 30, more than 40 ideas per session. How to do a tamponade balloon with the 2 Foley catheters, a double G stent with feeding tube, many models for lapar trainer, even a wireless endoscopic camera for about $100. So necessity is the mother of all inventions, like using gloves to cover clogs. So learning on vertebral simulator, it is impossible in our setting. So I had used a glove filled with saline for puncture. Also can use the smartphone and the light, like shiny shadows. And it is a really easy model. You can do it right now. Give me just a box, a glove, and paper. We don't have a needle, no problem. We can use a pen. It is a really good model, training on watermelon, or small piece of pumpkin, or any squash. In early 2019, with Dr. Osnek, we had experimented on many vegetables. So maximize what is available. So you are afraid doing PCNL because bleeding, no problem. You can do coagulation. You don't have an electrode, you can use the membrane sealant of the ureteral catheter. You don't have it, you can use a basket. For mini PCNL, or if you don't have it, you can use a hydrophilic guide wire. Also, we can do multi-use of the same equipment, like doing a second access with the rigid ureteroscope, direct vision with the rigid ureteroscope through a non-plug dilator. Drinking straw for on-plug sheet, I have done many cases, especially in pediatric population. You don't have a longer on-plug sheet, no problem. You can telescope one into another and cut it to length. You don't have a three-prong forceps, you can do one using a WG pusher. You need the basket for PCNL. You don't have one, you can use a nylon suture to do it. And you can fix it to the guide wire for rigid ureteroscope. So what is the other name of human beings? I think it is innovation. And it is starting more than 1 million years. And some say more than 3 million years. So my take-home message is all the techniques are easy and emancipate from bad history. And I will quote Bob Marley, emancipate yourselves from mental slavery. None but ourselves can free our minds. It will be good to have a codified institutional reuse of equipment and disposable. We have to have many sessions like this and in our meetings, especially in developing countries. And don't forget, affordable innovation are not just devices. We can just optimize what we have to have more idea and organization. I have lots of other videos and tips and tricks on my YouTube channel. And I will finish by inviting you to the next SIU meeting. It will be held in Edinburgh from the 29th of October to the 1st of November. And please submit your work, and the deadline for submission is the 3rd of April. and I thank you.
Thank you so much, Professor Lesrek, for all these eye-opening videos. Please, we're rounding up the session, but we want to express our gratitude by the EAU for the collaboration together with the SIU, and we want to reward you.